Hello and welcome to another podcast episode from Voices from the Lactation Field. And today we have an interview with Dr. Nupur, who's going to talk to us about why research matters in the lactation field in India. So let's hear it from her.
So, hello everyone. I am Dr. Nupur Bidla, and I'm a PhD in social work. And I did my PhD I studied the practice of breastfeeding in public spaces among urban women in Delhi, and it was a qualitative study. And I have 12 plus years of experience in breastfeeding policy domain, in media advocacy, and in training. I'm a master's in social work. I did my master's in social work from TIS Mumbai, and my PhD is from Jamia Millia Islamia. I'm also a national trainer on IYCF counseling trained by BPNI. And I'm also a member of NAPI and co-chair of the Global Council of International Baby Food Action Network. Thank you.
Thank you, Dr. Nupur. This is really great to have you with us. So we just have a few research interview questions. I'll go one by one. And we also have Dr. Shacchee and Dana with us here on the call. So we'll just have a collaborative interview right now.
Sure.
Yeah. So to start with, what motivated you to complete this research study?
Okay, so I began my research in 2016, and at that time there were a lot of news in the media where women were being shamed. They were being called out of restaurants from public places for breastfeeding in public places. A lot of celebrities were coming up with their testimonies that they were not treated well in a restaurant or at an airport. They were not supported enough. So it was a lot in media, and I thought this is an area that I should explore.
Yeah, thank you. Dr. Shacchee, Dana, do you have any follow-up questions with this?
So one of the barriers many of us have when we have an idea, we have these questions that come up, but then to go from those ideas to then complete a research study. Many of us aren't going to do a full PhD program. So how did you overcome some of those barriers when you were considering PhD programs? What pathway should I move forward with this? Can you give some encouragement to people who think like, I would love to do this, but there's lots of buts?
Okay, so we should not restrict our idea of doing research just with PhD thesis. I mean, that can be an individual aspiration if you want that degree for yourself. But for example, in Alpi, you all can, with your team, can do research projects and can decide on research questions. So the first challenge is to decide on a research question. So I knew I wanted to understand and explore the practice of breastfeeding in public places, but where, among whom, why urban women? Why only Delhi? So you need to decide your universe. You need to decide why you're choosing a certain group of women. Why not poor women? Why not rural India? So all of those discussions, they took place with my guide. And then I said, because I'm finding in my literature review that rural women in India do not face that kind of discrimination because the commercial influence is less there. And we see that the more commercial and globalized and civilized you get, the more you're questioned upon breastfeeding in a public place. So they find a woman with a bottle normal and a woman breastfeeding outside problematic if you're in an urban setting. Because then, there's sexualization, there's gender issues, and many more issues to it. So it is a Pandora box that opened at that time when I was discussing it with my guide. So for other people who want to pick up such practical research questions which they are finding in daily day-to-day life as a challenge in being successful to breastfeed, they can always do a popular study or do a survey sort of a study, do a quick qualitative study of experiences of women, and then come up with an information sheet. They can come up with a brief report. They can come up with a brief, say, if you're doing a quantitative study, for example, if you do a survey among your members, among Alpi members, about certain breastfeeding practices or notions or challenges that they face, and you jot down those challenges and then objectively ask them, right, what have they faced? So then you can easily come up with 4 5 things that this was the dominant thing that women faced among our members. So even that is a kind of research, a quick quantitative research. What I did was a descriptive qualitative study of experiences of women. So I studied the experiences of women, that why it happened to them, how were they perceiving it, uh, what exactly happened, where exactly it happened, what was guiding it. So all of these things. So once you pick up a topic, then you have to see it from the academic eye as well, right? From the scientific, the social science eye as well, if you're doing a qualitative study. If you're doing a quantitative study where you want to come up with numbers, that okay, this percentage of people thinks like this percentage of people think like that, or experience that, or experience anything else. So that is a quantitative study, which can be done at individual levels also. Like people do surveys on websites as well. You can run a poll on Alpi's website and publish those as your findings, right? And then use them as advocacy tools, use them for advocacy, use them for guiding any policy, making maybe helping yourself to improve as an association. I mean, it could be done like that also.
Yeah,
Yeah,
that's great. Yeah, Dr. Shachi, go
yeah,
ahead.
that's actually very interesting. And when you take so many names like quantitative studies, qualitative studies, surveys on websites, so for a person who has no background in research, who knows nothing about research, what is the way in which a person can understand it in absolute layman terms about what are the different ways to do a research? Is there some resource for that, Rumpur?
Okay, so if I tell you for a layman, there are three kinds of study now, actually. So one is quantitative, which is dealing with numbers, which is dealing with percentages, which has a huge sample size, right? And then there is qualitative research, which is about content analysis, thematic analysis, which is studying experiences, emotions, uh, cultures of people, a bit of those ethnographic and anthropology uh, like research. So those are. And then there is a mixed research where you do a combination of numbers and experiences, right? uh, so you have some data which is quantitative, and then out of that quantitative number, say for example, if it is a sample size of 500 women, you're doing some research, a quantitative research with them. So you take 10% of them and interview them and try and understand the why and how of those findings which have come in the quantitative research, to substantiate it. So there are three kinds of researches. I mean, everyone should know that there's a quantitative research, which is with numbers and huge sample sizes. Then there is a qualitative research, which is dealing with experiences, emotions, cultures, anything that can't be measured in numbers, right? You need to read between the lines. You need to understand people's perceptions, their experiences, their conditioning. Where are they coming from? Why do people behave the way they behave? All the behavioral sciences as well. And then the mixed research is where you do a combination of it, because now even the quantitative research, one of the criticism is that they don't cater to the experiences of people. So to substantiate their findings, they do some qualitative research as well. Either they will do a group discussion to substantiate their quantitative findings. For example, if in a survey it comes out that out of 500 people, 300 women think that it is helpful to have breastfeeding counseling during pregnancy, right? And rest of them don't feel that way. So to substantiate that uh, quantitative finding, you will have some group discussion and some notes from that, and some verbatims from that, which will support it. That okay, you have asked women their qualitative experience and of where they're coming from. That why do they feel that it is important to talk about breastfeeding in pregnancy? So these are the three things. And if simply, if they want to understand this, they can simply Google, read about it. There are a lot of modules that are available on YouTube about research methodologies, about various research designs. So there are various research designs, there are methodologies how you can do a research. So when you are doing a research, you need to decide your objectives first. Your research question, what are your objectives? What are you looking for? And then based on those objectives, you decide your research design and your methodology. Like how would you do it, right? How would you go about it? How would you decide your sample size that I have to take 500 women or 1,000 women or say 40 women? Like in my research, there were 40 women whom I interviewed. And that 40 women, I arrived on that number based on saturation. So when you're doing a qualitative research about experiences of people, you take as many interviews as possible, and then there'll be a time where you will find that the same kind of data is coming up, or same kind of experiences are coming up. So that is your saturation point. So after interviewing 40 mothers, while I was doing that, I realized that a similar kind of, I did more than 40 interviews, but I realized it was similar kind of responses. So there was data saturation. But for quantitative research, you have to decide your universe, okay, so to make it generalized. Like for qualitative research, you cannot generalize it because it is based on some people's experiences, right? It can help you to maybe understand the nuances of a situation, or nuances of say for example, if you have to make a policy, then how would it affect people on the ground, right? And lekin agar aap, when you're working for a quantitative study, so you have to decide whether I'm doing a study in Delhi or I'm doing a study in Mumbai. How many pregnant women are there in Mumbai, for example? So what percentage of it I'm going to study? Usually it is 10% of your universe, right? So you will find that in a lot of quantitative research, the sample size is in thousands. Why? Because maybe their universe was that and it was 10% of their universe. And then only you can make any generalization as such if you want to make in your recommendation.
Yeah, thank you so much for explaining that in depth and then just answering that question. So, you, I think you've kind of answered this.
Yeah,
What
I
kind of
answered
research
that.
have
Mine
you
was a
conducted?
qualitative
Qualitative.
descriptive study.
Yeah.
Yeah. And by qualitative descriptive, I mean, so I studied what, when, how, and why of that experience of breastfeeding in public. So I first, initially decided that I would go and talk to women about their experience of breastfeeding in public. So there was actually no substantial data on it because it was a very brief question, right? But then I realized that I need to ask them uh, from since the time they were a teenager, how they perceived breastfeeding, what was their experience as a spectator when they were a young child, how they were conditioned as a girl child, what was the concept around breast growth and breastfeeding, and did anybody talk to them about the natural function of breast? What do you have them for? Nobody did that. So how the infant feeding behavior was actually also guided by their gender conditioning when they were teenagers, and the kind of family scenario they had, whether they were supporting parents, conservative parents, right? And the perception changed when they became a mother. They stopped judging other mothers, but they were judging when they were not, they didn't have babies. So I started this entire trajectory from being a teenager, then being a young adult who is just married and not pregnant and did not have a baby. Then after getting pregnant, how things changed. After delivering the baby, how things changed.
Yeah. So, when you said that you had a sample size of like saturation point of 40, but what was your sample population? If you can just maybe focus on that
So
more.
because I wanted to study urban women, so we thought Delhi would be the appropriate place because it is a melting pot of a lot of cultures, and I thought that I would do it in. So my universe would be the 5 zones of Delhi, right? South Delhi, West Delhi, East Delhi, Central Delhi, and North Delhi. And the initial plan was that I would go and try and take 10 samples from each of the zone so that I can justify that, okay, I've covered Delhi. That was the plan. But then it didn't materialize because COVID hit. And then I had to collect my data from home through phones. So I changed my approach. My initial approach was to go to hospitals, to go to lactation clinics, approach them, tell them about my research, and get volunteers from there. But that didn't materialize. So I approached people like you and other independent lactation counselors and send them my request. And then women from those groups and their groups, they volunteered for the study. So it was, the idea was to do purposive sampling, that I have a purpose, I have a criteria, and I'm going and finding them with that criteria. But then I had to rely on volunteer sampling, where I put down my criteria to those women, and then it's their wish whether they want to come and participate or not. So
Yeah.
that was it.
So when you're talking about like COVID hit and all of these, so what were some of the barriers in collecting this data apart from
The
not
barrier
being able
was
to
that
meet
I
them?
wanted to do it in person, so I couldn't do it in person. It was mostly on phone. Then women usually with young babies, I couldn't get their time in one stretch. So sometimes one of my, like, few of my interviews were in fragments, whenever they have time. So it is in 5 installments, say, for example. There was one mother who was a professional dancer, and she had a young baby who was born in COVID, and she had many issues. And she was very keen on giving the interview, but she didn't have the time. So what she did was, for every question, she sent me a voice note. So I had to, download it and analyze it. So I had 14 voice notes from her. So you can imagine. So I couldn't cross question or do any probing with that particular case. And then a lot of interviews I took in the night when the baby was asleep and there was no one to disturb. Some women were not comfortable doing it in front of their husbands or family as well.
And like you said, like you were like reviewing the voice notes, but that was maybe like one or couple cases. So how did you analyze the data that you had collected from
So
all?
what I did thematic analysis. So when I made my tool, I prepared a set of questions based on broader themes. Okay, so they were, for example, I wanted to understand their experience as a girl child and the experience of puberty. So I began with that as a broader theme, and I have 4 5 questions in that. Then moving on to when they were a young adult as a spectator, when they were young, when they spotted women who were breastfeeding around them, what was their experience, what was their perception, what were their feelings, that. And then then the labor, when they got pregnant, their experience of pregnancy, their experience of labor room, then their experience of coming back home, how were they supported, and then moving out of house with the baby, that when they were claiming public places. So it was the questionnaire was actually divided in broader themes, and every theme had 4 5 questions. So it was a semi-structured sort of a interview question in questionnaire. And then I asked them, and if in between it was needed, I used to probe and I used to give extra information. So interviews were like somewhere between 40 minutes to 1.5 hours, and then I transcribed them, all of them, listened to them, typed them down. So it's a lengthy process. It is a very, very difficult task to do. The most difficult, actually, than analyzing it. So you have to hear it again and again and write it as it is on a Word document. And after that, then that is, so for every question I prepared an Excel sheet. For every question I had 40 responses, right? And in that I identified my codes. Were there any patterns that were repeating? Were there any concepts that were repeating? Were there any experiences that were repetitive, or emotions that were repetitive? They were coded, and then I prepared my scheme of chapter for that. For example, if I have to write the chapter on puberty, so on puberty there were around 3 to 4 questions. For every question there were 40 responses. So you can imagine. So sometimes what happens is, even there are a lot of new things that come up while you're talking to them, and then you have to prepare that new theme as well. For example, uh, women talk a lot about coping mechanisms. So I never thought that I would have a chapter on coping mechanism. I just thought that maybe I would put it in the experiences. But I realized there was so much data on coping, and there was so many patterns in the responses on coping. I made an entire chapter on coping mechanisms. And then I had to study a bit of psychology also for that, to understand what kind of coping mechanism was that. Was it positive? Was it negative? Was it problem solving? Was it emotional? Was it restricting themselves? There were some women who restricted themselves. They thought that until the breastfeeding cycle is over, I'm not moving out of the house. Until my child is 6 months old, that he or she starts eating solid food, I'm not moving out of the house. So they restricted their mobility, so which is a negative or self-restricting sort of a coping mechanism. So like that.
Yeah, I think like I've asked like quite a few of your very specific data related questions. I have a few more questions in my list, but at this time I want to open it up like to Dana and Dr. Shacchee. Do you have any other follow-up questions with what Nupur has already answered us?
I think it's helpful just to hear her experience and to know that, you think, oh, it's only 40 women. Oh, it was only in this small area. But
Yeah.
every question has 40 responses. And so even in a qualitative experience, it still
That's
is a
not a
lot of
data.
work.
There
Yeah.
are there are people, for example, I would recommend, if you go to Google Scholar, okay, or go to PubMed, and you write any qualitative study related to breastfeeding. Go just read their methodology. Like, I would recommend to everyone to understand that how researches work. So there are researches which only have maybe 10 people, or
Yeah.
10 sample size of 10 people, or 5 women, or 5 case studies. You can also do research with 2 case studies as well.
Yeah.
It's a case
Yeah.
study, it's an experience, right?
Yeah.
So you can do that, but because why quantitative research, which is working with numbers and percentages and huge data sample sizes, they're easier because you have softwares for that. You have your Excel sheet for that. So you can quickly, for example, you have 100 responses, you will put it in your Excel sheet and you can get yes or no, or the percentages. But in
Yeah.
qualitative, you have to put your brain, mind, read between the lines, look at these codes, patterns, and
Yeah.
then write your interpretation also, because you have to analyze that. And then you have to put theoretical perspectives in it, other sociological perspective in it, collate it with other data,
Uh,
uh, or other evidences that is there similar to your work, right?
right.
There's a lot of research. I realize in India, maybe there's not much research on my topic, but in abroad, there's a lot of research on breastfeeding in public spaces. There was one observational research which I studied where they made a breastfeeding mother, women, go to restaurants, different sort of restaurants, and then they just analyzed, they recorded her experience of how different restaurants and their managers, they behaved with that women, and based on those observation experience, they did a research on that. So there is a lot of creativity also, that is there in qualitative research, and you can actually, can be as creative as possible, as far like until you are following a scientific way of doing it,
Uh,
right? I attended a qualitative research workshop, where with some university professors from Canada, I think. Yes, and they taught us research based on pictures. So they gave us an assignment where there were 30 participants, that you will go, and you will go and click a picture of anything that you like, and we will sit and analyze it, right? And then she distributed those picture among groups, and then she said, whatever you think is coming to your mind after looking at that picture, just jot it down. We jotted it down. So they got around 30 responses on every picture, right? And then they said, let's analyze these uh, interpretations that you have written, right? And then they analyze based on patterns, and then they came up with their findings. So you can be as creative as possible. You can use art, you can use music, you can use anything. So you
Yeah.
go to Google Scholar, find a qualitative research, and just read their methodology, how they have done it,
Right.
right?
Yeah. Yeah,
Hmm.
and I think so many times people think medical studies, they think drug research, right? But
Hmm.
research can mean so many different things. So
Yes.
it's really great to
So
hear.
very few people, there are very few experts in this field who do qualitative research because it is difficult. We're
Um,
dealing with humans, right?
yeah,
We're dealing with human emotions, experiences, cultures. So it is a difficult task, and even the analysis is very difficult. So
right.
it's plethora of evidence. So 40 is a huge sample size for a qualitative study. People do it in 20, 10, 15, 5 as well.
Um,
Yeah.
yeah, that's good to know. And a lot of us as lactation professionals, we have these skills, right? We
Yeah.
interview our
Yeah.
clients every day, and we listen to their stories and we find patterns, and that informs evidence-based practice, right? Because
Yeah.
we see these patterns and that's how we then implement
And then,
interventions and
yes,
outcomes.
there
So
are experimental studies as well. You can do an experimental study as well if
yeah,
you wish to. So once you go and read about different methodologies of doing a research, different kind of designs of doing a research, there's scope for everything. So
right.
especially in our profession, if we want to study the practices from the medical perspective, or we want to see any correlation between a health hazard or a health issue, or a positive health outcome with a breastfeeding practice, right? Then
Mm,
maybe you can do a medical research or experimental research or a randomized control trial and all of that. For that, you would need uh, ethical clearances as well, from medical fraternity if you're doing. So if it is about practices, any health outcomes, you choose a certain kind of research. But if it is about experiences of people, you can always choose qualitative research. And in
yeah,
our profession, I feel that we are very medicalized. We do not see breastfeeding from a social aspect. There are so many sociological issues also which affect breastfeeding.
so true. Yeah, and it's always multifaceted, right? So
Yeah.
it's not this or this. It's always
Like,
a both
I
and.
had an option. I worked in breastfeeding for so long. I could have worked and analyzed on, say, breastfeeding practices in a certain setup or in a certain state. I could have gone easily and studied that. How,
Yeah,
what are their breastfeeding rates? How are they doing it? What are the practices that they are using? But that's usual research. I wanted to, because I'm from a social work background, I wanted to see it from a social work perspective.
yeah, that's great.
Yeah.
You're encouraging us to keep moving
Yeah.
forward. And we all bring our flavor. I think that's what I'm hearing you
Yes.
say today is, we all have our personalities, we all have our specialties, we all have our values. And so you want to do research that you're excited about because it sounds like hard work, right, Chachi? Even if, it's not 1,000,
Hmm.
40 coding,
Yes,
all of these
20.
things,
For
you know,
example, among your people whom you counsel, if take consent from them, you consent from them, you conduct a couple of group discussions around certain topics which you believe need to be studied, right? Or need to be
yeah,
explored. And then record those group discussions, transcribe them, and then analyze them. And then maybe you can come up with your research findings.
mm,
And then the best part is, if you're doing this independent research, which is self funded, for example, right, you can write a paper based on that and send it to a reputed journal for publishing. Why not? Then you have generated scientific evidence.
So, Nupur, that's actually quite a lot of information we are getting here today. And you have been mentioning things in between when you say you need consent, you need approval of the ethical committee, and
Mhm.
quite a lot of things. So, again, I'll come back to the same question. Suppose I want to do a research, or someone who has started working as a lactation counselor wants to do a research. So, what would you suggest? I heard you said Google Scholar, go and see a qualitative study, read their methodology. That's all good. But is there also a way where someone can start absolutely from zero? They can understand what are the basic prerequisites, what is it that I need to be like prepared about. So again, I'm coming back to the same resources what one can read in
Uh,
order to be able to venture into this research.
so I can definitely share those resources with you if you want to read about research methodologies and want to learn it from scratch. So and about the ethical clearance and everything, if it involves humans, no, even if it is human experience, usually for medical research you need a ethical clearance, right? If you're doing any test on anybody or testing something, or even a anthropological study, even a anthropometric study, if you're doing, you need to ask your doctor. Usually it comes out of a medical college. Every medical college has their own ethical committees which sign off that. If I am doing it from a university, I don't need to take an ethical clearance, but there are certain universities who do have a committee of their own, and they give ethical clearance to the students. So it depends. For example, we at NAPI, when we do research, so we did research on, say, food products, right? We analyzed their advertisements. It did not involve humans, so we didn't need not to take any ethical clearance on that, right? We analyzed it, we wrote a paper based on that report, and we published it in Indian Pediatrics. So it is a piece of scientific piece of evidence now. So, I mean, that is a pertinent question. I can get back to you by consulting with some experts or my research guide and people that I know, that if you wish to do an independent research, and which is with people, right, which is with the women who are lactating, women who are approaching you, then where all you can take, those clearances from, or whether you need it or not, you know. So we have to. So ICMR has a guideline on that. I can find out and share that with you. That ICMR has protocols for doing researches. Yeah.
Yeah, thanks Nupur, for that. So, when you're talking about like all of these things, so I think the main question that comes up is like when you have your research, so who supported you in this process? And then, like as Dr. Shacchee asked, like, can you conduct a research alone? I think you a little bit touched on that, but yeah,
Yes,
who supported you in
absolutely.
this?
Absolutely. So today, if I decide to do, say, a content analysis of all the advertisements that are present about feeding of baby, right? Forget bottle feeding, breastfeeding, anything. Anything for 0 to 2 years of children is what kind of information is available on the internet. And I decide a stipulated time so that I will study it between May 1st to May 30th, right? And whatever I came across through digital media platforms, right? Or I choose a platform on Instagram, say, and I analyzed the content, that what are they talking about, what are they recommending, what is dominant, what are the patterns, how are they selling it to you, right? So I can publish a research on that. I can write a paper on that. So each of my objective becomes my themes for uh, analysis and for my interpretation. You're getting my point?
Yeah.
Yeah. So one can do that as well.
I think we wanted you to answer that differently though, Nupur, because you
Okay.
kept saying I think it's your advisor. I forget what word you were saying. So no, you didn't do it alone because you had
Oh yes,
support
I'm
of,
saying no alone. Okay, I mean, like, if an individual today decides wants to do a research, they can. That's
yeah.
what I meant. But yes, in the process, of course, my advisor supported me. My participants who volunteered to be a part of this research, all of you actually, you gave me space to present my findings during your two of your conferences in the past. Then maybe Camilla helped me while I was pilot testing my tool. So Camilla, and Shobha. They helped me with the pilot testing, and I shared my questionnaire with them if they wanted to give some inputs to it. Then BSIM mothers, they really helped me because they spread the word in their groups. Then there's a lactation counselor, Shilpi Mishra, who runs a group of 200, 300 women on WhatsApp. It's a peer support group, I think. So she really helped. So I got all of my women who volunteered to participate through these lactation experts and friends, because they spread the word, and they were sure of my integrity and honesty, because therefore they shared it in their groups and they recommended other people to be a part of it. And otherwise, your colleagues also, your PhD batchmates, because there's a constant discussion. You
Come on,
sometimes,
Shacchee, let's be batchmates.
yeah.
Welcome to Delhi.
Yeah, and also Sachi. In the beginning, when I was pilot testing, I came to BLK Kapoor and I went to Guru Gobind Singh Hospital, where Dr. Sangeeta Rani helped me for pilot testing. And at that time, I managed to get some, in her hospital, some women who were from a downtrodden background or who were economically weaker. So they came up with a different perspective. So I interviewed, I think, 4 to 5 women during my pilot testing. So there are a lot of people, actually, I might forget to take their names, but there are a lot of people who helped
Yeah,
in this.
it's such a long process, so that's encouraging to hear
So what I
different
meant
people
by
along the way.
conducting the research alone is that today, if Dana decides to do a research all by herself, she can. She
Yeah.
can be the single author of that
Yes. So
publication.
I would like to add or like I would like you to answer a question here, Nupur. So I got the perspective that you need support of people. I got the perspective that you can do it as an alone author. But my question is, suppose I don't know statistics, because whenever we did thesis during our post graduation, the thing that I always heard is you need to have a
A
basic grasp
statistical.
on, yeah, statistical analysis and all that. So, do you think if someone has zero background in that, for example, a plain simple lactation counselor who has come from a non science background, non maths background, if they want to conduct a study, so do you think they can do it without having the so called grasp on statistics, or is that mandatory?
So statistics, actually, you would need it when you're doing a quantitative research, where you have huge data to analyze. You have co-founding indicators. You have various indicators between which you're finding a relationship. But if you're doing a qualitative research, you do not need statistics. Like, I'm not good at statistics, though I studied statistics as a part of my coursework during my PhD. So we have to do 2 years of coursework before we actually start doing the real PhD. So we did that. We read all our subjects from social work yet again in that, and statistics was one of the parts. So I had to clear that paper. I cleared it, but I was very sure that I would never need it, because I don't want to do quantitative research, right? You don't need it. So in qualitative research, you can always study different methodology, different designs. There are a lot of tutorials on YouTube on how to analyze data qualitatively, right? So one can always learn. First, you have to make a framework, like a framework where your research question is set, right? What kind of methodology it needs, you need to understand that. First, you have to decide that. And then look, how would you analyze it? So you don't need statistics if you're doing a qualitative research. If someone wants to do a quantitative research, if you're not good at it, there are people who hire statisticians, right? So they take expertise, they hire statisticians, they give them their data, and they get a report from them. People do that also. So, like for example, in a medical research, now your principal investigator, I don't think would sit and do statistical analysis. He would have a statistician in his team who would do it, and then he would interpret from that and write the analysis.
So, one last follow up question on that. Suppose I'm doing a quantitative study,
Hmm.
right?
Hmm.
And do I need to have a basic idea about how to calculate my sample size, or again that I can take that help from someone else who knows statistics?
Hmm. So for that, you need, see, for your sample size, once you know your universe, I mean, to know your universe, you don't need a statistician. Once you know that I want to do it, say, in 5 states, right? Then in 5 states, if you decided whom do you want to study, and you know what is their strength there. For example, what is the population there of that particular target group you want to study, right? So you can decide on that, and then to derive that sample size based on that number, you can always take help of a statistician or a consultant with you. You can mention that in your research that you have done that with them. And there are basic softwares for analysis for quantitative which you might need to learn. I would say that, because there is SPSS. There are a couple of more Excel based softwares that you may learn. You can find it on the internet, and you can take courses. There are a lot of research organizations who run courses, who keep on coming up with courses on research methodologies, on statistics and data analysis. There are various workshops, so one can enroll themselves and get educated. So yes, for quantitative, you might need to, if you want to do it on your own, you don't want to spend money, because then there are finances involved also, right? If you're hiring someone. So if you want to do it yourself, you have to equip that skill. So you might have to opt for a brief short course also on these tools.
Yeah, thank you. That's very helpful.
So there are tools. So one is the analysis which I did was manual, right? I did it on my own. But to do even content analysis, thematic analysis in qualitative research, there are softwares who can do it. They are like AI based. So you upload your transcription there, and they will find out the themes for you. And then it's simpler, then you can work on your analysis. So they will help you. That manual work of finding patterns and course, that will solve. So there's one software called NVivo, which is mostly like, it's popular in qualitative research. People use it. It's a bit expensive. So it was my decision. I could use a software also, but I chose to do it manually, because the manual precision is something else. I mean, they can give you, the software can give you a theme, but then you have conducted the interview, right? That what was that particular person saying in that moment, or what was the intention, how were the expressions, all of that. But that makes your life easier. The softwares do make your life easier. And then there are courses on these softwares as well. Okay.
Okay. Yeah. So with that, like if we move towards a broader field, like when we talk about lactation in India, so what type of research topics in lactation would you like to, move forward in India? Would you like to see enough?
There were a lot of research topics which cropped out of my own research. Like I received a lot of feedback saying that, why didn't you study men? You know, why only women? What about men? What do they think of breastfeeding? What is their experience of seeing a breastfeeding woman in a public space? How do they operate when they see a breastfeeding woman? Where are they coming from? So one is that maybe in my particular research, I can study the men's perspective. And I actually prepared a brief Google form of 7, 8 questions, and I shared it in my network, asking men to fill it if they wish to participate in this brief research. And there were actually 10 men who filled that form. And there were questions like, have they ever seen anyone in their childhood breastfeeding? If they saw, what was their experience? What was their reaction? What were they told by their family members when they grew up? And what kind of support they would provide if they want to, or they find it cringy? All of that. So one can analyze that as well. Then there are researches which I think we can do based on gender and lactation. One can do on various coping mechanisms. One can do on the breastfeeding counseling and support during pregnancy. Like, uh, does anyone tell women about breastfeeding or not during pregnancy? Like, among my participants, a lot of them said that they felt betrayed by their gynecologist because nobody told them that it is going to be tough. It was taken for granted. So there are a lot of research questions related to that, because we have studied practices a lot from the medical perspective. Maybe you also have a lot of data based on what works, what doesn't work, right? That could be studied from the qualitative point of view. Medical research, I won't say, because I'm not an expert in that. I'm an expert in social sciences and social research and qualitative research. So for me, all the nuances of breastfeeding and women's experience around it could be studied.
Yeah.
Like, for example, a lot of people ask me that how your research would help social work practice. I said it would help in guiding policies for maybe better support for women at public places. So there were women in my study, half of them actually wanted to do breastfeeding in a public space, but they needed privacy. So they need a room. They need a safe, clean room. They say, we don't have a problem, but we need a room. And there were women who said that we want to do it anytime, anywhere. So we want people's mindset to change. To change the mindset, you need a campaign, right? You don't need an infrastructure. You need a campaign. So this can guide the government that, in India, the kind of shift that we are going through, we are getting more globalized and becoming a developing nation and all of that. And there's a lot of commercialization and capitalism and everything. You might need both the interventions. You need good infrastructure also for women who want to do it discreetly at a public place. And then you need to run a public campaign which will normalize breastfeeding at public places. So you need both of it. So my plan is that, of course, I would write to the government, sharing my findings and sharing my thesis, that they should do something like this. So I came across a woman who's an advocate, and she filed a case in the High Court, in Delhi High Court, on behalf of her son, young son, because she was not able to breastfeed in a public place. There was no infrastructure, and she filed a complaint based on, say, right to life. Uh, so this little child is appealing in the court that, where is my right to life? You have no good infrastructure. My mother is not able to breastfeed me. Where do I go? So then after that, the High Court asked Delhi government that, you tell me how many breastfeeding rooms do you have. So then they gave a data, there are around very few. They said at least make 100 breastfeeding rooms in Delhi. So the next question is, why only Delhi? Why not the entire country for women who want to do it but need privacy also? So yes, there is a lot that that can turn into a policy recommendation from your work. Okay, so how does the research impact the lactation field and beyond? Okay, so my
I
research,
think
or you say
I think
research?
Well, but I think what we're hearing you say is, you had these skills. Then there was this season of writing dissertation, doing research, but the skills before, the skills during, and the skills after, they all translate to the work you do every day.
Yes.
And so,
Yes.
whether that's advocacy, whether that's supporting families, whether that's policy work, these skills develop during different seasons, and that those skills during the interviewing stage and the
Yeah.
data
So,
collection.
for example, in social work practice, all they understand mostly is that social workers are working on field. So they ask me, you're doing all policy work. What about the field work? So I said, this has a policy recommendation for field work as well. So your NHM and ICDS, women are not counseled during pregnancy. Women are not supported at the labor table. They are expected to do breastfeeding on their own. So you need to get your breastfeeding counseling right during pregnancy. And then when these young social workers are working in the field in maternal and child health domain, why not, they also be trained in supporting a mother for a better position, correct position and attachment? Why not? They could be trained, they can help mothers on the field, or
Yeah.
say giving information about complementary feeding. So
Yeah.
there were a lot of recommendations actually that came out of this research. And also how women are treated at the labor table.
Yeah.
It is, there were a lot of women who said that there was one woman who said that I felt so humiliated. I was pushed, mistreated at a very uh, uh, top-notch hospital.
Mm. Yeah, the stories are all around us, right? And
Yes.
if we want to see equity, if we want to see access increase to skilled lactation care, it's not only the wealthy urban population in
Mhm.
Delhi, it's not only the rural population in Rajasthan. It's a problem everywhere, right? And so if we can say this and we can have anecdotal evidence and we can
Mm.
tell stories of time after time, a family C-section, a family coming 1-2 weeks later
Yes.
and is on so much top feed. But if we don't have data and we don't have research, then this is what policymakers listen to. This is what governmental organizations listen to. So we have stories, we have data, but now we have to come together and our voices have to
Like,
be
I
louder.
think there's one more very important area, is that when women are not supported to breastfeed and when they come back home, there's no one, they're struggling in that 1.5 month to get things right, and they have all sort of breast conditions. Somebody's having engorged breast, somebody's having a nipple cut, and how they're dealing with all of that. Nobody talks about those breast conditions.
Yeah,
I think people don't know that all of these things happen to women if they're not supported in
yeah,
the very first hour.
yeah. Well, and like you're saying in the ANC time period, right? That's when
Yeah.
we provide that
Yeah.
anticipatory guidance so that
Yeah,
she knows
even,
this
yes.
isn't normal. This isn't this. We need to move past these challenges, you
And
know?
also, while getting discharged, if a woman is not counseled well when she's getting discharged and breastfeeding is not established, say for example, right,
Yeah,
and she leaves home without much understanding in those insecurities, and it doesn't work out when she goes back home, nobody counsels her that you can come back to me if you face any issue. Then she struggles.
yeah,
And there's so much pressure from the family, from herself. There's guilt, uh, even postpartum depression. So, in my research, even in literature review, it came out that one of the reasons for postpartum depression is that they're not able to breastfeed their child
uh,
because they feel less of a woman or less of a mother. They're not able to do.
yeah, yeah. And these stories motivate us, right? And this is the work we do every day. This is why we keep going. It's not, oh, just this one isolated case, but it's
Yes.
story after family where the challenges persist. And the women and the families and the parents, they persist. But why not avoid some of these challenges so that the success story can start from the early hours? The success story
Mhm.
can start from I'm being discharged and lactation is going well. And then they don't need people like Dr. Shacchee and I. They say, oh, things are going well, follow up call, all is well. And they actually mean it, not just saying that out of shame and embarrassed of their story that they're actually failing, right? That's what they feel so many days. So thank
Mhm.
you, Nupur, for your work. And
You're
we're
welcome.
excited to
You're
keep going
welcome.
together. We're not going to stop.
So that is an end of another wonderful podcast, an interview with Dr. Nupur. Thank you so much for joining us and stay tuned for the next episode.